Hello, I'm Steve Sims. I am so pleased you're here today to join us in the Philadelphia Child and Family Therapy Training Center's blog. Today, we have a special guest. I'd like to introduce Dr. Todd to the group. Tom?
Hi, glad to be here.
Talking about your decision in the very early 70s to leave New York and come to Philadelphia to the Philadelphia Child Guidance Clinic and the University of Pennsylvania.
Sure. Like many things in life, it was one of those serendipitous things where, just a couple of decisions could have gone a very different way, and my life would have gone a very different way. I went to a presentation before family therapy was even invented, practically. It's way, way, way back. So at lunch, I said to him, "So if you really were bitten by the bug, which I feel like I have been, what would you do?" And he said, "Well, there's really no choice. You have to go to the Philadelphia Child Guidance, work with Haley and Minuchin." So that's how I got connected with the clinic. And Harry was my primary supervisor at the clinic back then. And I think for the first year, I was in supervision together with Lynn Hoffman. So Lynn and I met with Harry once a week, observed the interviews with the other person and Harry behind the mirror. So we would do all of our intakes in an observed context like that. But with Harry, he wouldn't let you get away with shit, and basically would focus on the therapist. He knew me really well. He knew my personal shortcomings and stuff. Didn't let me get away with anything, but he was incredibly supportive. And he always assumed, that I could find a way to do what needed to happen. He and Lynn would be watching, but he would assume that if he called in with a suggestion that I could figure out a way to do it. So, and I responded really, really well to that combination of support and freedom.
And let me make a comment about why I think you were doing a good job in the psychosomatic medicine, the psychosomatic family therapy area. One, that's one of the few psychiatric conditions that can quickly lead to death. It's a very serious and compelling area. And I think what you were doing is, rather than being a slave to theory and research, you were doing what the great clinician does, figuring out what works.
Part of why I loved live supervision and why I loved videotaping and stuff was how behavioral it was. And Sal would never like to be accused of being behavioral, but as far as I was concerned, I thought it really, really was. And I was doing a fair amount of training of particularly young psychologists back then, and it was all with video, and doing video work and observed, calling in or sitting in on sessions and stuff was really, really, really useful. So
I'd like to shine the spotlight on your work with Lester Lubrosky. He was studying Rosenwig's 1930s position that about the dodo bird effect, that in studying outcome in psychotherapy, most of the models did pretty good. And there was one not necessarily better than the other. They all did pretty good. That the therapist shouldn't really have a slavish relationship to the model. That they should really use it. And you're right. He's very psychoanalytic. He's very psychodynamic.
Right.
He appreciated how fundamental the relationship was in the process of change.
Lester was the reason I went to Penn originally. because I was very interested in psychotherapy research, but I also was very interested in working with Jay and Sal at Child Guidance. So I basically split my time. Lester was almost strictly interested in individual therapy, which is not surprising. So this is very early in the work with anorexia. I was excited to be a clinician on the project.
Your team's work in the psychosomatic family area really moved family therapy in an important direction, structural and strategic sort of approaches that really got family therapy worldwide recognition, because these were very serious cases that were failing with standard of care approaches. But lo and behold, y'all's work together on some of the research projects were starting to show excellent outcomes. It did more than plant the seed for family therapy. I think it cultivated the soil and drew a bright light on it.
No, it certainly did. And I think the other part was these were difficult, dangerous cases. The bulk of the outcome research with this population, was based on at least a couple of years of therapy. We were showing change, not cure, but change in 2 or 3 sessions. That was very much Jay Haley's contribution, because he was the one who basically said, if there isn't change with it by session 3, you need to, look more carefully, because you're not doing something you need to be doing. So I was also doing outcome research with Jay, and it was very interesting how short-term therapy actually was at Child Guidance, and that almost all the cases were finished within 10 sessions, even though Sal thought that was very short-term and probably wasn't good therapy. It wasn't long enough to be good therapy, but it was what people came for, and they got what they came for. Usually the therapist, A, wasn't finished, and B, wasn't as clear as the family was how much change had already happened. Getting the whole family together, especially one of the things that happened was getting the fathers involved. So really getting the family together, not just the mother, by itself was a pretty important change agent, I think.
Y'all stated in there, addicts and family therapy program focused on what works rather than what is theoretically interesting. And I hear you continue to underscore that time and time and time again, because that's really what the family is interested in, what works. The therapist's attention might be drawn elsewhere.
3/4 of the cases, I guess, had substance abuse in the parental generation, usually alcohol, but sometimes it was harder drugs and stuff. But so if you were looking at, is this a perfect father? The answer pretty much all across the board was no. But we were very, very intent on getting fathers involved, even if they had drinking problems and stuff. And we played down the drinking problems, and we were not involved in curing the father's drinking necessarily, except when it interfered with doing what needed to be done as a father. So in that sense, we were working with what we had, and finding the strengths in the family rather than some theoretical family that where nobody ever touched anything.